Salbutamol is a beta-2 adrenergic receptor agonist used to treat asthma, bronchitis, COPD, as well as prevent exercise-induced bronchospasms. In this video, let's found. What is albuterol? What is albuterol used for? Contraindication. What are the side effects of taking albuterol? How does albuterol work? How to use albuterol? What is albuterol? Salbutamol, also known as albuterol and sold under the brand name Ventolin among others, is a medication that opens up the medium and large airways in the lungs. It is a short-acting beta-2 adrenergic receptor agonist which works by causing relaxation of airway smooth muscle. Salbutamol was patented in 1966 in Britain and became commercially available in the UK in 1969. It was approved for medical use in the United States in 1982. It is on the World Health Organization's list of essential medicines. In 2020, it was the seventh most commonly prescribed medication in the United States, with more than 61 million prescriptions. What is albuterol used for? Salbutamol is indicated for I. The symptomatic relief and prevention of bronchospasm due to bronchial asthma, chronic bronchitis, reversible obstructive airway disease, and other chronic bronchopulmonary disorders in which bronchospasm is a complicating factor, and or 2. The acute prophylaxis against exercise-induced bronchospasm and other stimuli known to induce bronchospasm. Contraindication. Contraindicated in patients with high blood pressure during pregnancy, uterine infection, miscarriage, heart disease, and hypersensitivity. Side effects. The most common side effects are fine tremor, anxiety, headache, muscle cramps, dry mouth, and palpitation. Other symptoms may include tachycardia, arrhythmia, flushing of the skin, myocardial ischemia, rare, and disturbances of sleep and behavior. Rarely occurring, but of importance, are allergic reactions of paradoxical bronchospasms, urticaria, hives, angioedema, hypotension, and collapse. High doses or prolonged use may cause hypokalemia, which is of concern especially in patients with kidney failure and those on certain diuretics and xanthine derivatives. Pharmacodynamic. Salbutamol, INN, or albuterol, USAN, a moderately selective beta-2 receptor agonist similar in structure to terbutaline, is widely used as a bronchodilator to manage asthma and other chronic obstructive airway diseases. After oral and parenteral administration, stimulation of the beta receptors in the body, both beta-1 and beta-2, occurs because a. Beta-2 selectivity is not absolute, and b. Higher concentrations of salbutamol occur in the regions of these receptors with these modes of administration. This results in the beta-1 effect of cardiac stimulation, though not so much as with isoprenaline, and beta-2 effects of peripheral vasodilation and hypotension, skeletal muscle tremor, and uterine muscle relaxation. Metabolic effects such as hyperinsulinemia and hyperglycemia also may occur, although it is not known whether these effects are mediated by beta-1 or beta-2 receptors. The serum potassium levels have a tendency to fall. Mechanism of action. Salbutamol has a preferential effect on beta-2 adrenergic receptors compared with isoproterenol. Although beta-2 adrenoceptors are the predominant adrenergic receptors in bronchial smooth muscle and beta-1 adrenoceptors are the predominant receptors in the heart, there are also beta-2 adrenoceptors in the human heart comprising 10% to 50% of the total beta adrenoceptors. The precise function of these receptors has not been established, but their presence raises the possibility that even selective beta-2 agonists may have cardiac effects. Activation of beta-2 adrenergic receptors on airway smooth muscle leads to activation of adenyl cyclase and to an increase in the intracellular concentration of cyclic 3-5-adenosine monophosphate, cyclic AMP. This increase of cyclic AMP leads to the activation of protein kinase A, which inhibits the phosphorylation of myosin and lowers intracellular ionic calcium concentrations, resulting in relaxation. Salbutamol relaxes the smooth muscles of all airways, from the trachea to the terminal bronchioles. Salbutamol acts as a functional antagonist to relax the airway irrespective of the spasmogen involved, thus protecting against all bronchoconstrictor challenges. Increased cycle concentrations are also associated with the inhibition of release of mediators from mast cells in the airway. Half-life. The elimination half-life of inhaled or oral salbutamol has been recorded as being between 2.7 and 5 hours, while the apparent terminal plasma half-life of albuterol has been documented as being approximately 4.6 hours. Dose. Bronchospasm. Indicated for treatment or prevention of bronchospasm in patients with reversible obstructive airway disease. Nebulizer solution, 2.5 mg bid/TID PRN, 1.25 to 5 mg Q4-8HR P for quick relief. Aerosol metered dose inhaler, 180 micrograms, 2 puffs, inhaled PO Q4-6HR, not to exceed 12 inhalations/24 HR powder metered dose inhaler, ProAir RespiClick or ProAir Digihaler, 180 micrograms, 2 puffs, in PO Q4-6 HR, not to exceed 12 inhalations/24 HR. In some patients 1 inhalation, 90 micrograms, Q4 HR may be sufficient. Tablet and syrup, 2 to 4 mg, PO Q6-8 HR, not to exceed 32 mg per day. Extended release tablets, 8 mg, PO Q12 HR. In some patients 4 mg PO Q12 HR sufficient, not to exceed 32 mg per day. Acute or severe bronchospasm. Nebulizer solution, 2.5 to 5 mg Q20 minute doses, follow with 2.5 to 10 mg Q1-4 HR PRN or 10 to 15 minutes by continuous nebulization. Metered dose inhaler, 4 to 8 puffs inhaled Q20 minute for up to 4 hours and then Q1-4 HR PRN. Exercise-induced bronchospasm. Indicated for prevention of exercise-induced bronchospasm. Aerosol or powder metered dose inhaler, 180 micrograms, 2 puffs, inhaled 15 to 30 minutes before exercise. Safety advice. Albuterol while pregnancy. Therapeutic effect, reduces airway resistance and relieves bronchospasm. Pregnancy safety rating, category C, do not use while nursing. That's all the information about albuterol we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.